If you have low back pain and it hurts with rolling over or getting out of bed, or maybe it hurts with coughing or sneezing, I'm Dr. Anthony Davis. I'm going to show you how to get out of bed without as much pain. So you may have a stability issue, and that could be in the spine itself, that the spine doesn't like to rotate right now, and that could be because some kind of disc irritation, but it could also be any of the muscles or ligaments that go up and down the spine that are just irritated with rotation and stabilizing activities. So I'm going to show you a bit of a trick to get out of bed and have it not hurt so much. But this is not supposed to be a forever method. This is not something that you should take away and think, oh, I have to brace my core all the time for every activity ever for the rest of my life. That's not the case. This is just a tricky way to not have so much pain while your body heals on its own. Okay, so if you're laying in bed and you're on your back, and this is pretty common, I see this in clinic all the time, where people, when they roll over to their side, all of a sudden they get sharp back pain. Maybe it even goes down their leg, but not all the time. Sometimes they just get sharp back pain when they roll over. So what I teach them is how to brace their core and then roll, right? And then eventually we'll get up. I'll show you the whole sequence. So what it's gonna look like, I'll describe it once first, and then I will instruct you on how to do it. Essentially, we're gonna breathe into the belly. We'll breathe in, hold that breath, we'll roll to one side and exhale. Then we'll inhale here, and then we'll exhale as we get up onto that elbow. And then from here, we can breathe out, and then when we breathe in, I like to just cheat and use my hand here, and then we can inhale, hold it, get up here, and then at that point you should easily be able to swing your legs out of the bed, and then we can do another breath in and then stand up, okay? So we're really breaking it down. So this is really for people who have a lot of pain with any movement, and this is to make sure that you can stay functional, because the worst thing you can possibly do for low back pain is stop moving, is stay in bed and avoid activity. We want to keep you moving. Even if there's a little bit of pain, we want to just minimize the pain using these bracing strategies while things are a little bit sensitive. Okay, step one, if you're laying on your back, we want to be able to breathe into our belly instead of breathing into our chest. So just take one hand to your belly, one hand to your chest, take a couple of breaths in here, and see if your belly moves or if your chest moves. If your chest is doing a lot of expansion and contraction, then we want to try to aim that breath into the belly so that the chest pretty much doesn't move, and then the belly rises and falls when you inhale and exhale. So that's step one. Just get used to breathing into your belly. All right, now step two is that we want to be able to breathe out into our belly and then hold that pressure. So the way that we could test this is if we could just breathe into the belly, hold that pressure, and try to press your low back into the ground. So if you took your hand and slid it under your low back, then you would inhale into your belly and then hold that pressure and try to squish your fingers with your own spine and then relax. Okay, so that's kind of the feeling of bracing. Another quick way that you could get the feeling of how to brace your core is to basically just pretend like you're going to slap yourself in the belly, right? And you're naturally going to brace a little bit through your belly if somebody was going to slap you or punch you in the stomach. So you could even test by just slapping your own stomach and just tightening naturally. The key is that we do this on inhale. So we inhale, expand, brace, okay? So then the next step is that we will actually put this all together and start to do some movement. So the way it's gonna look is you'll inhale into your belly, you'll brace and hold your breath as you reach over to one side and use your opposing arm. So if I'm rolling to my right elbow is down on the floor, and then my left arm is going to reach across my body as I roll onto my side. This arm guides the movement, so you don't have to expend as much energy. So again, it'll look like this. You'll breathe into the belly, hold, and then hold the breath as you reach over to the side until you roll into your side. And then exhale. Okay, I'll do it one more time. I'm on my back. I inhale into the belly, hold, reach, 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 exhale once I'm on my side. Okay, now that I'm on my side, it's time for the next step, which is to get up onto the elbow. It's gonna look like this. I'm gonna breathe into the belly, hold, and then again, reach, 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 and prop up onto my elbow, okay? So again, inhale into the belly, hold, brace as I reach and kind of use a little bit of momentum and press up, pushing through my elbow to get up onto my elbow, okay? One last time from here, we inhale, brace, get up onto the elbow, exhale, okay? And then again, from here, we can inhale, brace, use our other hand, prop ourselves up onto one arm, and then exhale. From here, we just swing the legs off the edge of the bed, and then it should be easy to scoot to the edge of the bed. I'll show you the next step from there in just a moment. Let's review that entire process. So as a whole process, the way this is gonna work is, I'll guide you through it. You're laying on your back. We inhale into the belly, brace, roll to the side, exhale. Pause here, take a breath in. Brace, get up onto the elbow, exhale. Okay, now we inhale, brace, get up onto the arm, exhale. And now we're just swinging the legs over. Okay, now, essentially all we're doing is now we're on the edge of a bed. Just pretend I'm on a bed. It's the same as getting up from a chair. So now we're on the edge of the bed. I don't want the bed to be way over here where your knees are still touching the bed. I want you to scoot way to the edge of the bed. Scoot way far away from the bed. Take your feet nice and wide. Okay, I'll show you from this angle. I'm taking my feet nice and wide here so that I have room for my pelvis and I can lean forward and reach forward. Or you could take your hands to your knees to help you get back up. All right, so from here, we take the feet wide. We're scooting way to the edge of the bed. We lean forward. We either reach forward and then we'll inhale, brace, and get up, or we take the hands to the knees, inhale, brace, and get up. I'll show you with the hands on the knees first because this is going to be easier for people with a lot of pain. So we inhale into the belly, same way, brace, hold the breath, and get up, and then exhale. Or if we're reaching forward, so again, we're way out on the edge here, we're leaning way forward, okay? Now our weight is on our feet. It's gonna be easier to stand up this way. So inhale, brace, hold your breath, reach way forward, and exhale as you stand up, okay? And then you could actually, once you get used to it, you could practice just doing squats. We want to ease you back into normal activity. And the process of getting into bed would be everything I just showed you, but in reverse. The basic premise here is that if we brace our spine by bracing our belly, every time that we move in a way that moves our spine and moves those muscles and ligaments, while things are tender, sensitive, then we can brace it and we can reduce the amount of pain that we feel when we move. So with transitional movements, like getting up from seated or rolling over or any of those things, we just inhale into the belly, brace, do the movement while we're holding the breath, and then exhale, right? So this is kind of like weightlifting. We pick the weight up, inhale, and then exhale, stand up. Remember, this is meant to be a temporary solution. You should not be bracing like this for the rest of your life. This is just while things are a little flared up, we're trying to make life a little bit less painful for you. Eventually, we want to ease our way back into normal activity. And eventually, you shouldn't have to think to brace. You should just breathe normally and your body should be bracing on its own. It should be fine. So don't walk away being paranoid about, I have to brace constantly. That actually leads to really bad outcomes. This is a temporary solution. Eventually, just do normal activities and don't overthink. I'm Dr. Anthony Davis. Motion is lotion, movement is medicine. So even if you have low back pain, in fact, especially if you have low back pain, get out there and move your body every single day.